Assalamu alaikum now. It's time for ethics. Start with core principle. Ethics. Ethics principle in medicine. What are those? It may be beneficence, non-maleficence, autonomy, justice, and proportionality. So beneficence promote good and act the best medical interest of the patient. Promote good and act in the medical interest of the patient. It is beneficence. Non-maleficence, do not harm to the patient. Autonomy, protect and facilitate the patient's individual and informed decisions. Beneficence like mm, you are taking like a patient you have like beneficence like a patient you have found that he is not taking a proper decision and he is taking wrong decision, you know that. So like surgery doing or not, if he do the surgery there is chance of 99% possibility of dying in the OT table, but if he takes the other option then he can survive for a long. So that that is the beneficence. So promote good and act in the best medical interest of the patient. And non-maleficence like do not harm to the patient. Autonomy, protect and facilitates the patient's individual and informed decisions. Justice, equally distribute the health care resources and provide fair and equitable treatment. And proportionality, ensure that methods used to achieve a worthwhile goal are necessary, appropriate, and not excessive. Autonomy does not obligate the physician to provide non indicated or inappropriate services, regardless of patient request. Like autonomy, like patient obviously has the right to take decision for herself, but if it is suicidal then the physician has to think, then physician should not provide non-indicated or inappropriate services like people some people want some weight reduction agent like ephedrine, and we know that ephedrine can cause hypertension and stroke. So if he insists to write a prescription for ephedrine, we will not gonna do that. We will try to make him understand that it is not the right choice, and you can take other options of weight reducing medication, which is mm, FDA approved, like orlistat is and other drugs. So if he insists to do that, then we can say the patient to come for regular visit. Why? If something is happening, like if he has if he developed hypertension, if he develop signs of if he develop any sort of problem, then we can monitor. So the patient's autonomy to receive a requested medical treatment is always subject to physician's medical at judgment and discretion. When deciding whether to provide a requested treatment, the physician should consider whether the treatment is consistent with whether the treatment is consistent with ethical and evidence-based scientific standard, whether the treatment potentially benefits the individual patient beneficiaries, whether the treatment avoids unnecessary or excessive harm, non-maleficence, whether the patient treatment avoids unnecessary or excessive harm, non-maleficence. When counseling parents who request non-indicated service, physicians should empathetically explore patient motivation. Patients with low back pain are less likely to request imaging studies when they believe the physician has performed a thorough physical examination. Physician has performed a thorough physical examination and that checks the serious pathology and they receive a specific explanation of their condition. Recommended practice include of the following: apply patient-centered rather than paternalistic approaches to build a patient-physician partnership and directly address the patient's concern. Perform a detailed physical examination giving special attention to areas that are concerning to the patient and providing ongoing commentary on what structure are being assessed, and the significance of the finding. Patients have the right to refuse treatment except when doing so poses a serious threat to public health. So patient has the right to refuse treatment except when doing poses a serious threat to public health. Like somebody has tuberculosis, and tuberculosis, if he does not take the anti-TB drug, then he can spread TB to a lots of person whenever he goes to in public. In this case, the physician is justified in restricting individual liberties until the public health is no longer at risk. Physicians have ethical and legal duty to treat the patient with life-threatening conditions, regardless of patient's behavior. The physician duty to treat comprises the ethical and the legal component. These were EMTALA, Emergency Medical Treatment and Active Labor Act. The emergency medicine provider physician must provide a screening examination, appropriately treat and stabilize patient and transfer the patient with limited expectation only after the patient is stabilized. So seek permission for primary attending surgeon to be the assistant surgeon in the procedure. Although there is no federal law that prohibits physicians from treating and performing surgery on medical members, the American Medical Association clearly advises against it because doing so raises ethical issues of professional objectivity, patient's confidentiality, and personal feelings that may cloud judgment. Exceptions to these recommendations include medical emergencies in which no other qualified physician is present and treatment of the minor treatment of minor condition. In this scenario, the physician explicitly asks his daughter to perform surgery on him by asking the primary attending if she may assist the procedure. The daughter manages to balance the ethical principle, avoiding treatment of the family members with patient autonomy, honoring her father's preference. So in here, what they are trying to say, that treating or performing surgery on family members is strongly prohibited. But in case of medical emergency, the patient explicitly asks his daughter to perform the surgery on him by asking the primary attending surgeon if she may assist the procedure. The daughter manages to balance the ethical principle, avoiding treatment of family members, and with patient's autonomy, honoring the father's preference. So she need to seek from the primary attending surgeon to be the assistant surgeon in this procedure. Now, medically futile treatment. A medically futile treatment clearly offers no benefit, physiologic improvement, reduction in suffering, and cannot accomplish intended goals. Medical futility can be defined as physiologic futility and qualitative futility. Physiologic futility treatment cannot improve physiologic condition or reach a physiologic goal, including promoting palliation or comfort. And qualitative futility treatment offers marginal benefits that are substantially outweighed by the likelihood of significant pain and suffering. Physicians have no ethical obligation to administer futile treatment because doing so encounters ethical obligation of beneficence, benefiting the patient and non-maleficence, not harming the patient. When a patient or surrogate decision maker requests a futile treatment, the physician should attempt to understand the reasons for the request. Distrust, concern for abandonment, overestimating treatment benefits, and empathetically explain why the treatment is futile. In contrast, the therapies are at high risk but offer some benefit, prolongation of life via CPR in some patients without a terminal diagnosis, not clearly futile. In case the physician should offer a clear guidance but cannot refuse treatment if it is requested by informed and compliant patients. Physicians should not feel pressured to order tests. Physicians should not feel pressured to order tests that are not medically indicated. Requests for additional testing should be declined in a non-judgmental manner, accompanied by explanation of why the test is not the patient's best interest. Consent. Elements of informed consent, precondition, disclosure of any key facts, and other disclosure if applicable. Preconditions: competency, voluntariness, disclosure of key facts, diagnosis, proposed treatment or procedure, alternate treatment option, medical, surgical, risk and benefit, proposed treatment and alternative. Okay, disclose the student's identity and training status to the patient and ask for consent before surgery. A patient or or their surrogate should be briefed about the risks, benefits, and alternatives of the procedure. An authorized plan, a physician should balance the responsibility to train medical students with their obligation and provide optimal care, non-maleficence, while upholding the right of patient's autonomy. If a student wishes to assist the surgery, the attending surgeon should inform the patient about the student's identity and the level of training, and the patient must give informed consent for participation. As with any other decision, the physician has the right to refuse students' involvement in their case at in any time, just as patients have the right to refuse trainee involvement in their case. Physician has the right to refuse elective care for patients who do not consent to trainee participation. Informed refusal requires discussion of the same elements: diagnosis, proposed procedure, risk benefits, alternative risk of refusal, and required for informed consent. Exception to standard informed consent: life-threatening emergency. The patient lacks decision making. The patient decided to waive the legal right. Disclosing may pose a threat to the patient and or affect their decision making capacity, that is therapeutic privilege. Okay, okay, look at this question. Admit the patient and initiate appropriate treatment. So although parental consent is usually required before minor child age less than 18 years of age in most US to receive medical care, it does not apply emergency situation in which there is a legal obligation to treat in order to save the child's life or a limb. Since severe neonatal hyperbilirubinemia, severe neonatal hyperbilirubinemia has a very high risk of permanent brain damage and death, it is a life-threatening medical emergency and immediate therapy is necessary. If the medical condition threatens the child's life or limb, the effective treatment can be delayed for a short while. Early stage cancer, a court order should be obtained if parents refuse the treatment. Assuming all other measures to convince the parents have failed, parental refusal to consent to therapy is legally permitted when there is no risk of serious harm to the minor. For most vaccination refusal, or when minors has a terminal condition that does not have an effective treatment, advanced metastatic cancer, or certain high-grade brain tumor, a parental decision to decline routine immunization for an unvaccinated child is often tolerated as the risk of acquiring infection in a community with herd immunity is relatively low. In contrast, in contrast to elective vaccination, if a patient is at high risk of tetanus infection, if a patient is at high risk of tetanus infection from the deep puncture wound, administration of tetanus vaccination is urgent and should be done regardless of parental consent. In patients with divorced parents, only parents with custody may give consent for medical care. Parents with joint custody are each able to consent, but consent from only a parent is all that is necessary to be proceed with treating the minor, especially when the decision is clearly in the child's best interest. In all cases, treatment is ideally discussed with both parents to reach an agreement that will help the child and facilitate cooperation between the treatment team and the parents. Obtaining informed consent from patients with mild intellectual disability may require recruiting assistance from family members, mother, to explain the information in familiar terms. Explaining information in simple language while brother is sick and needs to be taken out using visual aids, illustration of gallbladder, choosing a comfortable setting with minimal distraction, choosing a comfortable setting with minimal distraction like quiet room. If following further discussion and the patient demonstrates decision-making capacity and refuses surgery, that refusal should be honored regardless of underlying intellectual disability. The patient does not demonstrate if the patient does not demonstrate decision-making capacity, ask the surrogate to make decision. Capacity communicates a choice, patient able to clearly indicate preferred treatment option, understand information provided, patient understand condition and treatment options, appreciate consequences, patient acknowledging having condition, likely consequence, treatment option including no treatment and rational given for decision. Patients able to weigh risks and benefits and offer reasons for decision. Patients with psychiatric illness do not necessarily lack of decision making capacity. If a patient's psychotic symptoms do not interfere with understanding or ability to communicate choice regarding medical treatment, the patient has the right to refuse treatment, even if it would be life-saving. If the patient has mild schizophrenic symptoms like hearing loss but is effectively communicating a choice is understanding respect that. Competency is a legal determination made a judge about the patient's global decision-making ability. In contrast, capacity is a clinical determination made by a physician about patient's ability to make a specific medical decision at a specific moment at the time. I understand you want to go home, but you don't have to, but you have to stay in the hospital for as long as you are intoxicated. This patient is able to state his choice, no treatment, but his understanding, appreciation of the relevant fact, and ability to describe the reasoning for his decision are most likely impaired by acute alcohol intoxication, as the patient currently does not have decision making capacity and discharge would seriously endanger his health. He should remain at hospital until sober. If a patient decision-making capacity is temporarily impaired because of alcohol intoxication and their condition is not life-threatening but requires hospitalization, admission and reassessment of the decision when the impairment have subsided are necessary. Irrespective of the state laws, if a patient believes that patient cannot drive safely, the physician must share their concern with the patient and ask them to stop driving until they have been evaluated and treated by a driver rehabilitation specialist. Surrogate, higher authority, patient design proxy, durable power of attorney, court appointed guardian, lowest, next of kin, default surrogate, spouse or partner, adult children, parents, adult sibling, Older adults, relative and unrelated friends. Hmm. Next of kin surrogate. Patient selection, inability to communicate wishes regarding medical decision. Advanced directive not available or applicable. Surrogate selection priority to physician spouse. Priority to patient spouse. And implementation substituted judgment what the patient, not a family, would have wanted. Physician can assist distressed surrogate decision makers by guiding substitute. Refocus the decision, help for surrogates apply their knowledge and emphasize shared decision making. Leave against medical advice, medical management of AMA discharges, confidentiality. Okay. Uh, that's all about the first part of ethics. Hope you enjoyed.